stage investment for healthcare startups. Our first panelist is Stoakes, co-founder and president of Startup Health. Startup Health engages with early stage entrepreneurs that carry the potential to significantly improve healthcare. They have the world's largest portfolio with more than 280 startups from 23 countries. The second panelist is Jens Francis, co-founder of AngelMD. AngelMD is a network of healthcare startups, physicians, and investors that utilize physician insights, community engagement, and algorithms to highlight promising investments. Third panelist is Shruti, director and Kaiser Permanente Ventures. Surprisingly, very few people know that Kaiser has a venture wing, and today Shruti is going to tell us all about it. Please give a round of applause for the three panelists, and let's get started.
How are you?
Pretty good. So, to start off with, can each one of you in brief introduce yourself and tell us how you started your venture or maybe joined the VC from your end? Starting off with Unity.
Hello, it's good to be here. My name is Stoakes. I'm the co-founder of Startup Health. We are really trying to achieve 11 global health moonshots. These are global missions, each that can impact at least 1 billion people. And our plan for doing that is to invest in and organize a global army of what we call health transformers. These are entrepreneurs, innovators, people, like many of the people in this room, who believe that it's possible to reinvent the future of health. And what we do that I think is pretty unique is we don't think about our portfolio as individual entities. We unite them together and connect them together to focus on achieving these health moonshots. As you mentioned, we have 282 portfolio companies from 23 countries. So we're investing globally. It's at the early stage, seed and A, but our last 2 deals were actually Series B. So we do go all the way up to Series B, and we're honored that Kaiser is actually one of our investors too. So that's what we're doing.
So I'm Jens Francis. I'm the co-founder of AngelMD. When we started the company, we decided that we would go out. My background is as a computer scientist, so what our working premise when we started the company was to go out and start looking at what beasts lie at the intersection of very large networks like AngelList, very large networks of physicians like Doximity, and analytics driven by advanced computer science. So really what we set out to do was build analytics that helped build a predictive model around what early stage healthcare companies would be successful and track key success indicators over time. We built all that, did a number of very successful investments. We did about 40 financings over about a 3-year period, a little less than a 2.5-year period. Very strong IRR. Really feel strongly about that predictive model that we built. Now I've taken a leave of absence from AngelMD, and we're looking at now taking that analytical model and moving it into financial products like venture funds, private equity funds, and hedge funds. So I had my 50th birthday. I quit my job and I grew my John Stewart beard, and then started working on really interesting large problems. So that's
I'm Shruti Kothari. I lead strategic engagement for Kaiser Permanente's venture capital fund. So a little bit about the fund, first of all. We are a mature investor, Series B, post-Series B. We've invested about $400 million. We currently have about 25 active portfolio companies, with over 60 investments in the fund. While it's not unique for a plan provider system to have a venture fund these days, we were one of the first to do it. We started our fund in the 90s, and our fund has evolved since then. And so, of course, mission to bring financial returns back to operations, but as we've understood our place in the marketplace, essentially, and how we can support relevant and significant innovations that helps our members, providers, operations, there became a need for this function of what we call strategic engagement, which essentially I focus on two things. One is understanding the evolving needs and significant trends in Kaiser Permanente perspective, essentially, and seeing where is it that we actually need relevant innovations on tech and services. Where are we not looking for big vendors like Epic to build out? Where are we not building internal capacity, essentially? And then really helping our investment leads understand those evolving perspectives and then aligning with our investment themes. And the second area is, as our companies come into our portfolio, how do we create more mutually beneficial relationships between our portfolio and Kaiser Permanente operations? We don't tie our investments to operational decisions, but more than 50% of our portfolio do have partnerships with Kaiser Permanente. So I support all of those partnerships. I support things like product development for our portfolio, and then really just generally, when we think about business development and we think about how hard it is, understanding large enterprises when you're a smaller startup sort of stage company, helping create some clarity and transparency and connections to the right relevant operational leaders. My background is, I call myself reluctant to the venture field. I started off as a health educator in medically underserved communities, went on to run national quality programs in outpatient, home health, hospice, and home-based palliative care. And what I think is really amazing about our venture fund is when they were hiring for this role I've been in this role about 2.5, 3 years, and this sort of was the task of our investors before I came on board, and so I created this program for Kaiser Permanente Ventures, and they were specifically looking for somebody with a clinical, operational, or quality background for this role. Understanding that bridge and conduit role, you really need to understand perspectives.
So in healthcare, you have medical devices, healthcare services, health IT, digital health, pharmaceuticals. What exactly do you focus on, and where have you seen the highest return on investment? Be it return in form of improving patient lives or financial returns.
I mean, I can take that one first. So at AngelMD, one of the things that we did was we had a very large network of startups that we worked with, right? So there's probably a pretty good nuance. Because what we found with respect to our physician investor networks was that we were looking at about 60% medical device, about 30% split between biopharma and digital health. We didn't really skew toward digital health because our algorithms really kind of broke down in the software side of the technology space. I mean, what we found was the prescriptive algorithms that we had, the predictive algorithms, the prescriptive path that these companies followed was much more applicable to med device and biopharma than it was to digital health. We really still feel like there's a lot of things we found some interesting stuff that we liked, but generally those were components of a medical device.
So we broadly classify it as health innovation. We see digital spreading across every subsector of health. So while we classify most of our portfolio as digital health, that would include health tech, there's services, there's companies just focusing on innovative business models, med tech, we're even looking at biotech. We do see a digital transformation cross-pollinating into all of those. So we have consumer, we have industry focused. What we believe is that the whole layer of health is being reinvented, but it's moving on what I call sort of this health innovation paradox, where it's moving, the innovation's happening faster and slower than we hope or think at the same time. So there's a whole group of innovations and technologies that are very relevant to solving real world problems today, integrating into the current workflows, integrating into the current business models, and solving real challenges that need to be fixed. At the same time, there's this whole other layer of what I would call leap forward innovation that's in some cases changing the business models or changing what is possible. And I think about what's coming over the next few years, and even the panel we saw right before us, and how these new technologies start making their shift from things like entertainment into health. So I think our industry will benefit greatly from the innovations happening in all these other areas, whether it's AI or whatever we want to talk about. So we're investing in I would say a whole index of health innovation because we don't believe it's possible to know where it's going. It reminds me like it's 1994 web. You know, it's just very, very early.
The one thing I'll just add is, when you look at the big kind of buzzes, right, when people like clinician burnout or absorbing growth, access to care experience, there are these big buzzwords. But I think where there's really targeted is when you have a company or a space where you overlap on a lot of those different things. So just for example, Genome Medical is a company that we recently invested in, and there are virtual genetic counseling services and a whole host of other kind of tools. With the demand that 23andMe and services like that have created, there are not enough genetic counselors, generally speaking. And so when you think about that problem case and you think about a virtual genetic counseling service, it gets at all of those things I mentioned: absorbing growth, creating access, care experience for patients, clinician burnout. The current genetic counselors are overworked to meet this demand. And affordability too, that's a huge one with the virtual option. So that's sort of what I mean by you have these big buzzwords, but if you are a company who claims to only be focusing on one of those things, I think that is a red flag. You have to be kind of addressing a lot of them.
So you said there's a lot of uncertainty. So how does your evaluation of startups at your each respective levels, like Series A, like large scale hospital adoption, how does that go ahead?
Sorry, so do you mean like how do we evaluate companies for like adoption? So we typically, right, so the ability to operationalize something, you could have the most fantastic product, but if it's hard to integrate into current systems, it's not going to get adopted anywhere. It just isn't. The money and the time, the energy, the effort, everything it takes to do it. So that's one thing we strongly look at, and not just from an implementation side, but also from an investment side. I'm saying 2 minutes.
And I would say, our predictive models have taken a lot of that stuff into account. I mean, we really go through a pretty in-depth analysis on a lot of the component pieces of that. The other thing I was going to mention that's just reminded is, there's a really big law of unintended consequences around this emerging health innovation. So what we're seeing are, as you start measuring and putting devices on people, you're finding a lot of things that a lot of really interesting innovation or interesting data that's falling out of just having it completely, in the drug space, it would be kind of off-label. So there's a lot of off-label information coming out of these devices. I think we'll see more and more. I was reminded when Unity mentioned that, which is really great if you're promoting innovation in the space. It's pretty difficult if you're a VC.
So we focus mainly on the entrepreneurs, on the health transformer. The first thing we look for is, are you committed long-term? It takes so long in this sector to really see your innovation through and to make a true success. So long-term commitment, we look for batteries, including entrepreneurs, coachable entrepreneurs. We focus much more on the people and the team as opposed to their idea or business model. Because of what you just said, I mean, it evolves over time. You learn from the data, and you innovate over time. So if the team has that commitment, if they're committed to a health moonshot, if they're coachable, then we're very interested in supporting them. The other thing is we look globally. I think there's a lot of amazing entrepreneurs and innovators all over the world. And I think it's just a big opportunity to support those entrepreneurs wherever they may be.
Okay, so unfortunately time's up and I still have a lot more questions to go. But yeah, so you can connect with the panelists offline or maybe like email them.
Thank you.
Thank you so much.
Thank you.